Hi, I'm Dr. Tracy, and I'm going to show you around our surgical area and tell you a little bit more about your surgical consent form that you probably are filling out on your phone. So the first couple things on this form are obvious. Name, your pet name, your email, and what procedure we're doing. What's really important is the phone number that we can reach you at during surgery. Sometimes in the middle of the procedure, we have a question or concern, and it's really important that we can get a hold of you. So please be sure to mark the best number to reach you at. The next thing on your form that you might have some questions about is the pre-anesthetic blood testing. What this is a blood test that checks liver function, kidney function, electrolytes, a white count and a red count to see if your animal has any other conditions that may affect anesthesia and make it a risky procedure. We recommend this on every single animal that we sedate and put under anesthesia, but we understand that some of you are on a budget and you're needing to do things in a more economical way. Now, this pre-op blood work is not optional for major surgeries, broken bones, major dental work, anything that's geriatric. The next thing on the list is an IV catheter. Also, we definitely recommend that every pet that's undergoing surgery have an IV catheter. An IV catheter is actually what runs fluids into your pet to keep them hydrated and support their blood pressure. This is required for all major procedures, major dentals, enucleations, amputations, all these bad things. But for your routine spays and neuters, again, because of economics, we make that optional, but please understand it mitigates risk, and I do think it helps with the recovery of your pet to have them really well hydrated. Next thing on the list is the microchip and the miscellaneous services. We are fans of microchips. This is just a microchip reader. They're an amazing way to identify your pet and help recover them if they're lost. Miscellaneous procedures would be pedicures, extractions, anal glands, vaccinations, anything else that you want us to check. Be sure to mark that. So to finish our tour, this is the area where your pet will be while they're waiting for surgery and while they're recovering. Chico, you're fine, buddy. You're fine. These are the stations that we do our blood draws and our pre-op physical exams. We actually do surgery in here. This is our surgical laser. We use a laser instead of a surgical blade. It reduces pain, it reduces blood loss. We love it. This is the only way I've done surgery for the last 15 years. We also have monitors in here. This is our surgical monitoring. It monitors EKG, which is the rhythm and rate of your heart, your pulse ox, which is oxygen saturation, your pet's body temperature, their blood pressure. It's a pretty cool machine. These are our anesthesia machines. This is the one that we use most commonly. We use different tubes and bags to deliver air and anesthetic to them through a trach tube. So when the procedure's done, we take them back to their kennel and we recover them. So we will call you when their procedure's done at the end of the morning or sometime between noon and 1 o'clock. If you'd rather not have a call, if you'd prefer a text that everything went well, you can go ahead and mark that on your form also. And the last thing on the form is payment. You can mark your preferred method of payment, and that will expedite things at the end of the day when you pick your pet up to go home.